beyond vacuum. My topic centers pneumatosis cystoides intestinalis. Definitions. Pneumatosis cystoides intestinalis is a condition in which submucosal or subserous gas cysts are found in the wall of the small or large intestine. There are fulminant and benign forms. Fulminant pneumatosis cystoides intestinalis is associated with an acute bacterial process, sepsis, and necrosis of the intestine, whereas benign pneumatosis cystoides intestinalis can be totally asymptomatic and seen as an incidental finding at laparotomy.
This is the right hemicolon of an asymptomatic 54-year-old man presenting for his first screening colonoscopy. As a surprising incidental finding, we see these bulky cysts within the colonic wall. As you can see here, there are both small solitary cysts and complex large bulky cysts. The lesions arise in completely normal-looking mucosa and are covered by regular mucosa. In this case, the cysts are predominantly located in the right hemicolon, and there are only a few cysts in the distal parts of the colon. What we see here is the characteristic macroscopic appearance of pneumatosis cystoides intestinalis within the colon. This is an unusual condition characterized by gas-filled cysts that are located within the serosa or submucosa. Typically, the cysts are surrounded by regular and non-inflamed mucosa. This feature is very important because it allows clear differentiation from the linear form of pneumatosis that is the result of bacterial invasion of the colon wall in necrotizing colitis. This is a completely different, life-threatening scenario. Pneumatosis is a rare finding, but it is important to be aware of it because these lesions are easily mistaken for submucosal tumors and inadequate therapy might be initiated. Indeed, it is not uncommon that these patients are referred for surgery or endoscopic resection of these lesions. This should be omitted because invasive therapy is rarely indicated. How can we prove that indeed these lesions are filled with gas? To prove it, the cysts are punctured with an injection needle and the air is aspirated. Immediately, the cysts collapse and the diagnosis is established. In asymptomatic cases like this, no therapy for pneumatosis cystoides intestinalis is required.
Applications in nursing. It can be located in any part of the intestine in a limited and extensive area and affected to different layers of the intestinal wall, from the submucosa to the outer part. It is detected in the plain radiography of the abdomen and with greater precision in the CT. There is a discussion about the cause of the process and the pathophysiological mechanism that it causes. The intestinal pneumatosis should not be confused with the existence of gas inside the intestinal tube, a common process that affects the entire population. Pros and cons. Pros. The prognosis is favorable and do not require surgery. Actually, the techniques, especially in relation to computer tomography, have allowed to increase the sensitivity in the diagnostic. Cons. It can be presented bad in adults and children. In neonatal patients with necrosis, enterocolitis, a disease with high mortality, and infrequent complication of discharge can be observed in the presence of gas in the portal vein that is associated with 60% of mortality. Issue appeared in Ecuador. At the Kennedy Clinic in the city of Guayaquil, there have been several causes. A 68 years old female patient was admitted to the emergency service due to an exacerbation of her COPD secondary to an added bronchial infection process, which has not resolved with oral antibiotic therapy. On physical examination, the patient was dyspneic, pale but cooperative. Physical examination: asymmetric chest with bronchi and wheezing in bad hemithorax and decreased hair sounds. Globular abdomen, soft, depressible with decreased air fluid sounds. 48 hours after admission, the patient presented increased abdominal distension, for which a computed tomography of the abdomen was performed, which revealed dilation of the intestinal loops and the presence of free fluid in the pelvic cavity. Conservative management with hydration, oxygen therapy, and empirical use of antibiotic therapy was decided, but due to her pulmonary history, the patient suffered decompensation and died.
During routine colonoscopy in a 63-year-old healthy man, multiple submucosal polypoid-like lesions, 3 to 8 millimeters in size, were noted in the area of the splenic flexure, extending over an area of approximately 30 centimeters. Since they appeared to be soft and had a bluish tinge, an attempt was made to puncture them with the use of a standard biopsy forceps. As can be seen, the submucosal lesions empty and collapse after puncture, confirming the presence of gas. This video shows the endoscopic appearance of pneumatosis intestinalis.
Conclusion. Cystic intestinal pneumatosis is a finding with multiple causes. The advent of imaging such as computer tomography has allowed for more accurate descriptions and the identification of additional patterns and sex therapy that the radiologist can guide the clinician to define whether this finding is secondary to a life-threatening disease such as mesenteric ischemia or it is primary and requires only symptomatic management.